Gentle lady from Alabama, Ms. Sewell.
Thank you, Mr. Chairman. And I want to thank our witnesses for being here today and sharing your stories and your perspectives. I represent Alabama, and I could close my eyes and listen to all of you speak and know that the folks that I represent share many of your concerns. This hearing is about the state of American economy, not Democratic economy, not Republican economy. It's the American economy, and you all have reinforced that. It's about making sure that all of us are vested in the success of this great country that we live in, and that irrespective of your wealth, your race, your gender, we all want to achieve the American dream. We may differ on how we get there, but I think all of us want to achieve the American dream. You know, this month marks the third anniversary of the COVID-19 breakout. I think all of us know that it was a global pandemic. It was not a hoax. It was 1 million people died. Folks in my district that were of color, who had chronic diseases, died disproportionately more often than others, but 1 million Americans died. And I think that no committee had a bigger impact on trying to mitigate the downturn in the economy than the Ways and Means Committee. And I am very proud of the fact that we were able, if only for 1 year, to give a fully refundable child tax credit. And Ms. Kantz, I wanted you to talk a little bit about that. I can tell you from the perspective that of my constituents, I had lots and lots of fathers, not just mamas, telling me how important it was for that income support, especially during that vital time. And it did lift people out of poverty. In my district alone, it lifted 30% of the children out of poverty for that 1 year, often because it was an increase in the amount that was given. And as you rightly pointed out, it was given on a monthly basis, not a one-time basis. And so can you talk to me a little bit about how that affected your community? And if you could also talk to us about how it affected members of the Cherokee Nation and how income support was vitally important during that time. And it taught us a lesson, because we came out of this pandemic stronger. This economy, 12 million jobs were created in the last 2 years. But I mean, we obviously have things to do, but it's about a balanced approach and making sure that employer and employee alike are prospering in this great economy.
Thank you, Representative Sewell. As a citizen of the Cherokee Nation, I definitely applaud all the work that the tribes have done. There's 38 federally recognized tribes in Oklahoma, and they have truly been a beacon of how to care for your citizens. They have definitely stepped up and used the resources, and Cherokee Nation alone has a $3 billion economic impact on Oklahoma. So very proud citizen here, but I definitely think that the federal government would do well to honor the sovereignty of those nations and speak with them, have the table equal for the nations to speak to their citizens' needs individually and not as a whole. And as far as the child tax credit, not everybody has a parent who can watch their kid. Not everyone can afford to work fewer hours. Not everyone works 9 to 5 hours. How many child care systems do you know that are set up to support night shifts? Our hospital workers, our doctors, where are they finding their child care? If they don't have a community, we talk about having boots and pulling ourselves up by our bootstraps. I wasn't born into a family that had boots. Yeah. We got hand-me-down boots, and we had a community and a village around us that helped with those boots. What are we doing in Oklahoma? What are we doing in America to ensure that we're sharing boots, right? We really need to show up for the working class, our middle class. We heard about the wealth gap. It's real. It's real. It's greater than it's ever been in the history of the United States. And we really do need to show up for our working class families.
You know, the other thing that you mentioned that I thought was really poignant, my state did not expand Medicaid. And frankly, we've seen lots of rural hospitals close because we didn't expand Medicaid. And I think that when you're going through a global health crisis, to not have health insurance, to not be able to provide for yourself and your family, just further undergirds what you were saying. Mr. Chairman, I just want to conclude by just making a comment and observation. We on the Ways and Means Committee, because we have tax and trade and healthcare in our jurisdiction can use our tax code to really help working families and entrepreneurs and small businesses alike. We would do well to remember that we're all interdependent, that what happens to one of us definitely does affect all of us. And so thank you with that. I want to again thank our witnesses for their testimony.
I want to thank the general lady. Recognize